Hi, I'm Dr. Irfana Koita, fertility consultant. Today I'm going to talk to you about a very common cause of female subfertility, which is involvement of the tube, whereby the tube has had either previous infection or is damaged following a surgery, for instance. Now, the tubes are a very important organ when it comes to trying to get pregnant. The egg gets released from the ovary. It then needs to travel through the tube. Fertilization usually takes place in the tube, and then finally the fertilized egg, what is now known as the embryo, needs to find its way along the tube into the womb. And hence you can see that the uterus, the tubes and the ovary play extremely important roles in the process of trying to get pregnant. Now, if someone's had an sexually transmitted infection, for example, chlamydia, then that may have had a long-term effect on the tube and may block the tube. What this means then is that either the tube is completely blocked and there will be no passage of the egg, or sometimes the tube may start filling up with fluid. As a result, this fluid may backtrack into the womb cavity and make the environment within the womb less optimum for the embryo to implant. Now, as you can see, I've got a model which demonstrates a cut section of the uterus. We've got the tubes on either side, and they're the ovaries just lying next to the tube. Now, when this tube gets inflamed and congested, fluid can start filling in, and this fluid can eventually backtrack and come into the uterus. Now, this can have a negative impact, whereby it prevents the embryo from implanting. Also, the other trouble of having a tube that has had previous damage is that it increases the chances of what is known as an ectopic pregnancy, or the risk of a pregnancy implanting within the tube. Now, this is quite a serious situation and is potentially life-threatening. When we are in a situation where the tube has fluid inside it, the best option is to try and remove the tube. If that is not possible, then one could consider clipping the tube, either by putting a telescope from the belly button, or alternatively passing some clips from down below, which is a relatively newer surgical procedure which is available in some of the hospitals. So if you have any worry of previous infections, you're worried about your tubes, then it is about time that you get investigated if you're trying to get pregnant. So feel free to come and see me, and we can talk about the options and how we can optimize your fertility journey. Good luck.